The Council of Education Ministers had a special meeting this morning to consider reports from the Department of Health on the latest developments with regards to the fight against COVID-19 pandemic. A plan for the vaccination program for the sector was presented to CEM, which is the Council of Education Ministers, and we are pleased with the progress made, especially for the basic education sector. As a sector, we had appealed to Cabinet and Department of Health that teachers should be prioritized, and we are excited that our request has been heeded. The request that we have made was informed by a number of factors, including the fact that since March 2020, as a direct result of COVID-19, the sector has suffered severely in terms of learning and teaching, and we feel that the ongoing instability in the sector is not very helpful for our country, even in the long term. We know very well that it is a very difficult act to balance learning and teaching vis-a-vis the health needs of our people. CM in its meeting this morning did welcome the announcement by the President that vaccines for basic education have been secured. We want to take this opportunity to thank the President, to thank Cabinet, and also to thank the Acting Minister of Health, Ms. Mamoloko Kubai-Ngubani, for also supporting us with the vaccination program. As a department, we've been working in partnership with the Department of Health. We've been working around the clock to finalize a plan on the vaccination of our educators and support staff. We've been working very closely with all our different stakeholders who also have contributed immensely to the success of the vaccination program. Subsequently, in the CEM meeting this morning, we also had consultations with our other key stakeholders in the sector. I had meetings with teacher unions this morning, the National Association for School Governing Bodies, and also governance structures which run our schools for children with special needs. I also had a meeting with independent schools. I had a meeting with South African Principals Association to appraise all of them on the latest developments with regard to the sector's report to COVID-19, but also to update them on the progress around the vaccination of educators. With the support and guidance from the Department of Health, the vaccination program for DBE will unfold with immediate effect. And we're urging all our teachers to say, and everybody else who's in the sector, to say, let's pull all stops and make sure that we do vaccinate all of us in the sector. Dr. Granville will give more details around the vaccination program. It will start the Wednesday, the 23rd, which is next week, and continue until the 8th of July when we close our schools. We will be vaccinating all teachers in the PESA, which is where we register our educators, administrative and support staff, irrespective of age. We'll also be vaccinating, this I thought I should raise because it kept on being raised in the morning. We'll be vaccinating even teachers who are school governing body appointed teachers and those employed by independent schools. That's why we also had a meeting with them to make sure that we have a comprehensive program of all the educators in the sector. In total, for the next 10 to 14 days, we plan to have almost 582,000 people in the sector vaccinated. And there are stringent guidelines which we have been given by health that if you are on a PESA, your details have already been captured on the electronic vaccination data system. Also, we have received the list of SGB appointed educators and from independent schools, but also using the information that we have from SAIDS. We want to emphasize that we will not, or the system, not even us, will not allow an on-site registration, meaning that persons not bulk uploaded on this vaccination information system, they cannot be registered on site. Therefore, which means they won't be vaccinated. And this should, if it should happen that you are not vaccinated, you have to go and register and come back having been registered on the system. The Department of Health and Basic Education at provincial and district levels will work together to link schools with the identified vaccination sites which have already been agreed on. The verification of basic education staff where the electronic vaccination data is offline will also make a plan to make sure that indeed we ensure that the vaccination process goes very well. We also want to note the following exclusions so that people are aware and they don't present themselves, that if we have had contracted COVID-19 in the past 30 days, health says you can't be vaccinated. If you already have been vaccinated like myself with Pfizer or under the Sisonke program, you can't be vaccinated again. And any person who had received a flu vaccine in the past 14 days won't be vaccinated. In our deliberation with health, it was further agreed that the vaccination program must cover staff that transport learners, our staff which is in the feeding scheme, our staff in the trade union movement organization, and also want to emphasize that vaccination is voluntary, but highly recommended so that everybody can be protected. And we want everybody to work with us to fight against COVID-19. And everybody is expected to make their own transport arrangements, but coordinated with the schools. We don't want anybody to wake up and the principal hear that we have gone to vaccinations when there have not been proper arrangements. We'll coordinate properly as a sector, we'll coordinate with the schools, we'll coordinate with the Department of Health. So in the next 2 weeks, we want to make a clarion call to all our school communities that they must drop all and vaccinate. In order for us to successfully complete this program, we will need to keep schools open, and any disruptions we think will be undesirable. Vaccination of everybody in the sector is an opportunity for us to normalize and begin a process of mitigating on the impact of COVID-19 on our sector. We feel that we have to need to work extremely hard around the clock to vaccinate as many people as possible in the sector. But we also want to emphasize, which is what health also asks us to do, that vaccination does not mean that we must stop adhering to non-pharmaceutical health and state protocols. The scientists and the Department of Health told us that the vaccines do not provide 100% protection against the virus. So even though they are very important in the fight against COVID-19, but we should strictly adhere to the non-pharmaceutical measures to curb the spread of the virus. So on the management of COVID-19 cases in schools, we also want to urge schools to apply the standard operation procedures when managing COVID-19 related cases. Every school must have a COVID-19 committee, and they know that, a COVID file, and a compliance officer. And I said earlier that doing business under COVID-19 means that one needs to also strike a balance between saving lives and livelihood. In the case of the education sector, it means we need to do all we can to protect potential academic disaster. At all times, we follow the advice of public health who are supporting us in the management and the impact of COVID-19. And as a sector, from all the meetings I had this morning and even before, we are of view that schools must remain open. And saying so, we are not insensitive to the concerns raised about the rising infections. The position that we want to, which we will be presenting to Cabinet and also to the National Coronavirus Command Center, is that COVID cases must be handled case by case in a differentiated approach, on a province by province, school by school, and therefore if there is an outbreak, the school must be handled there, and it cannot be nationalized for any other reason. So while there are disruptions in the sector, the majority of our schools remain fairly stable. And I also made the example in the morning to say just this week we had reported cases of 100 schools which were disrupted. And in the sector we have more than 25,517 schools. So which means 25,500 schools or 400 schools remain stable. And on that basis, that's why I was saying, let schools and provinces handle any outbreak or any problem school by school and not really expect that we'll shut down the system because of, yes, the cases that we have been witnessing this week. We also noted that last week, because the infections were high in the Northern Cape, there were more schools disrupted. Because the cases have dropped in the Northern Cape, less schools are disrupted. This week, there were higher cases of infections in Gauteng, more schools were disrupted. And that's why we say, let's handle the matter case by case. But we also agreed that we will take guidance from structures such as the Ministerial Advisory Committee of Health, the NCC, the Cabinet on this matter, and we will continue to monitor the situation on a weekly basis and make sure that we don't risk the lives of our educators and our learners. So again, on the reopening of schools, if you recall that on the 28th of May 2021, as a department, we issued a government gazette in which we announced that primary school learners will return to school on the first day of the third term on the 26th of July 2021. So the decision, we canvassed it adequately within the sector with our key stakeholders who made inputs in the process. And indeed, we continue to be guided by various studies which looked into the teaching and learning losses already suffered by the sector, but more important, by scientific evidence regarding the impact of COVID-19 on younger children, as well as advice from the medical fraternity. So Cabinet did approve and supported the proposal by the sector to prepare for the return of traditional timetable at primary schools level with effect from the first day of the third school term, which is the 28th of July 2021. We gave ourselves 2 months to prepare for this mammoth task. At the moment, provinces are at various stages of being ready in terms of the return of primary school learners to schools on a daily basis. We are aware that there are many variables that will make this task a success, and DB is currently holding one-to-one sessions with provincial education departments that, again, when we reopen in July, indeed we are ready to receive all primary school learners back to school. On learner support programs for the academic year, I'd like to take this opportunity to remind parents, guardians, caregivers, and our children that the department and its partners continue to use alternative means of providing curriculum material. Again, we have repeated the Woza Matric Catch-Up Program and Tswelopele campaigns which we run through National Education Collaboration Trust and their partners. There are national supplementary remote learning campaigns developed to support the 2021 matric learners and learners also in the other grades, in the other phases, because we desperately do want to recover the losses that we continue to endure because of the difficulties of having our learners every day at school. So the 2 campaigns that provide digital and non-digital learning resources in partnership with a range of content providers through the DBE TV and OpenView channel 122, SABC 1 and DSTV Catch Up and the YouTube channels, as well as digital and mobile chat platforms. These platforms were put in place to minimize the negative impact of COVID-19 on learning and to provide further learning opportunities in the context of the restrictions that are currently in place. We also have what we call the Second Chance Matric program, which is proceeding well. These exams started on the 26th of May this year, yesterday, and they will continue for the next 13 days. So the only concerns that is facing us was also the protests which were in different parts of the body of the country, which disrupted some of the work that we have to do. So the department is looking at other options to assist the candidates who had missed their supplementary exams. I really want to take this opportunity to thank all MECs in provinces, heads of department, in the provincial departments, our social partners and stakeholders, and our colleagues in the sector, to also, as I say, which I have started doing, to thank the President and the Cabinet and the Acting Minister of Health for the support that they gave around vaccination. And because Elijah the main purpose really was to share information on our readiness around the vaccination of teachers. I'm going to ask Dr. Granville just to share information with the public as to what is happening, because we want people to spread as much information as possible around the rollout. We have set ourselves only 10 days, and therefore we need all the information to reach people in good time. So, Chair, I hope you will allow me to ask Dr. Granville to share information on the rollout of the vaccination for the sector. Thank you very much. Mask. Okay.
Slides. Good afternoon, everyone. Thank you, Minister. So I will just provide the details in terms of the program that we'll start rolling out next week. So we have been offered by the Department of Health an initial number of 300,000 doses. During the course of the week, the Department of Health communicated to us that there will be, in fact, more doses available to the Department of Basic Education. As Minister said, there was agreement that the vaccines will be made available to our sector, and the President has confirmed that. 300,000 doses of J&J arrived in South Africa on Thursday, the 17th of June. We do expect that additional doses will be made available and that those will arrive in the country next week. Together with the Department of Health, we've agreed that 280,000 of the additional doses will be made available to basic education. And these doses are expected to only expire on the 8th of August, which means we'll have enough time to do the vaccinations. And as we've agreed that we will conclude this particular program within a period of 14 days. So just in terms of the process, the vaccines have arrived. They're now being tested. They will then be released by Sunday this week to the provinces for distribution Monday and Tuesday. And as Minister has indicated, the rollout will formally start on the 23rd, which is Wednesday next week. And it will then be concluded the day before schools close on the 8th of July. Just in terms of the target population, so we've agreed that we will vaccinate all adults both in public and the independent school sector. Teachers, including SGB paid, admin staff, cleaners, volunteer food handlers will be vaccinated. All officials in the sector, including those in district offices, in provinces, as well as in the national office. There will be no age limitation to who can get the vaccine, so every adult working in a school will be vaccinated. And we've also agreed, because of the availability of vaccines, that we will include over 60s, even though they do qualify at the moment for the general population program. In terms of the exclusion criteria, I think Minister has covered these very well, so I'm not going to speak to those. These are just the numbers that will be covered. As Minister said, we've agreed that 582,000 people working in the sector will be vaccinated, including public teachers, non-educators, cleaners, admin staff, volunteer food handlers. We've included SGB employed educators and ECD practitioners working in public schools, and the independent school sector will also be vaccinated. It gives us a total of 580,000 people that will be vaccinated. In terms of registration, we have provided all the required information directly to the Department of Health. Data of PERSAL, SGB employed teachers, teachers in independent school support staff have all been provided to the Department of Health, and these have been uploaded into what the DOH calls a data lake. From the data lake, the data will then be uploaded onto the EVDS, and therefore there's no need for any teacher to register on the system. Anyone, however, as Minister said, who is not registered on the system will not be vaccinated, and we're talking to Health about exceptions that we can then pick up as part of a mop-up. Everybody will have to provide an ID card as well as medical aid details. There is a decision that the state will recover the money for the vaccination from the medical aids. But if you don't have a medical aid, you can still go and you will get vaccinated. Contact details will have to be provided so that if there is a need for follow-up, that we can do so. Just in terms of coordination, we've got a national team in place. We've got provincial vaccine leads that have been identified. They report back to us on a daily basis at the moment. There's joint planning between the two departments in all of the provinces, and we've got a communications task team that's working in terms of just getting these key messages around logistics and vaccine hesitancy out. In terms of the implementation modalities that have been preferred by the Department of Health in the provinces, fixed sites will be used in the Western Cape, Northern Cape, KZN, Northwest, Mpumalanga and Gauteng. These sites have now all been identified, they're finalized. In some of the provinces, Eastern Cape and Free State, they're probably going to use a hybrid model, so you will have fixed sites, but you'll also have mobiles to reach into far-flung or rural areas. And Limpopo has decided to use dedicated time-bound sites, which they are thinking of doing the vaccination over a fixed period, so maybe 3 days, and that in those 3 days, the sites, all the vaccination sites will only be available to teachers in the sector. As I've said, the sites have now been identified. These are available. We've also included the site capacity so that we know exactly how many teachers or how many people can be vaccinated per day in a particular site. The DBE will do the scheduling, so we will inform principals of the date of the appointment of a particular school, and the schools will then be expected to make that particular appointment. The slide is a little bit small, but what it does do is it demonstrates some of the planning process that we've gone through just to ensure that there's enough capacity in every single site to cover the numbers that we require. In terms of implementation logistics, as I've said, we're scheduling schools to vaccinate together. Johnson & Johnson will have dedicated sites, so those sites, the Johnson & Johnson sites, will only be open to the basic education sector. We are asking that teachers make their own transport arrangement to get to these sites. But we're also saying to schools that when it is difficult for teachers to access these sites on their own, that they make a plan to ensure that teachers get to those sites. We have been offered 100,000 free rides by the transport company Uber. These obviously will be made available in the metros, and we're hoping to make a further announcement just about the details of that particular process. Vaccination is voluntary, as the Minister has said, but if you are currently working remotely because of comorbidities and you refuse to vaccinate, then unfortunately you'll have to return to school. There's a process that the department has embarked on that will finalize in the next couple of days, and teachers will then be informed accordingly. Just in terms of monitoring and oversight, we are currently monitoring the readiness of provinces, and I'll speak a little bit about that now. We also, going forward, will monitor vaccine uptake so that we know exactly how many teachers are actually taking it, and also vaccination coverage so that we know when we have problems in particular areas. So just in terms of the provincial readiness, Eastern Cape has identified a lot of schools as vaccination sites. They're busy doing their scheduling at the moment. We're very happy with the progress of the Eastern Cape. The Free State is quite advanced. We don't expect any problem there. They've identified the sites. They're matching the sites at the moment. Gauteng, we've indicated that with the Department of Health that we thought that they've identified too few sites, and they've worked hard over the last week to increase the numbers. KwaZulu-Natal, again, we're pleased with their progress. We've identified a challenge in Limpopo, perhaps a lack of coordination between the two departments, but we've addressed those. In the Northern Cape, just because of the geographic size of that province, we are concerned about the long distances, and so there's additional support that we'll provide to the Northern Cape. We've had some data issues in the Northwest, but those have been addressed, and we're fairly pleased with the progress of the Western Cape. So just in conclusion, to say that we think that we are ready to start the rollout of this particular process on the 23rd of June. It does provide us with an opportunity to normalize schooling and to begin to address the impact of COVID-19. Of course, it will rely heavily on provincial and district leadership and working with our key stakeholders to ensure that we coordinate this process well. We do have about 14 days to conclude this process, and we call on all the stakeholders, all the teachers, to work with us to ensure that everyone who qualifies for vaccination in the sector does indeed take it up. Thank you, Chairperson.
Thank you so much, Dr. Whittle, for the presentation. We've also shared the presentation with our colleagues using the platforms that we generally use. And also thank the Minister for the statement earlier. We've now come to the time when we take questions. I have a few colleagues from the media in the room, but we also have a WhatsApp line where some are able to send their questions. So I'm going to check, Ignatius, do we have any questions yet on the WhatsApp line before we come back to the room? If we do, please let's go with that, and then we'll proceed.
Okay, thank you, Mr. Mhlanga. I have just one question, or rather 3 questions from Nazir Nur Mohammed from Glow TV. He asked, will those running tuck shops at schools be allowed to vaccinate in this program? Will teachers who refuse to be vaccinated be allowed to teach as normal? Will another opportunity be given to those teachers who presently have COVID-19 to be vaccinated at a later stage? Thank you, Mr. Mhlanga.
All right. Thank you so much for that. They've taken notes. Let's come back to the room. Any hands? I saw there were hands earlier and then they disappeared. And then there's one that has reappeared. Okay. It's Lindy there.
I just want to understand what the department has done in terms of finding out exactly how many teachers want to be vaccinated. Do we have a count, especially regarding the vaccine hesitancy that we do see that's prevalent? And also, what conversations have taken place in Gauteng in particular, seeing that there's been quite a drastic peak here in Gauteng, especially in terms of school closures as well. What discussions are taking place there?
All right, thanks for that. Is there any other hand in the room? I have also noted that there is, I think, one channel there that is streaming. It has said 5,800 to be vaccinated. It's actually 582,000. So we just need to make that clear because we don't want to disseminate incorrect information. I'm going to ask the Minister to deal with the questions, and Dr. Whittle will also support should the need arise. Ms. Mokgatle, please help us.
Yeah. For those teachers who may not be able to vaccinate for different reasons or the other, whether they had a vaccine flu or they've just had COVID-19 in the past few days, there will definitely be another opportunity where they'll possibly be vaccinated with the general population, because after the vaccination of teachers, we will have police vaccinated, so we will make sure that they do get a second opportunity. On those that choose, because there are principles that vaccination is voluntary, so no one's going to be forced to do it. But we're saying, because in the sector we have thousands of teachers that are home because of different comorbidities, diabetes and other things. And after this round, there won't be any opportunity for us to give exemptions to anybody. We'll expect everybody to come back, right? Whether we have comorbidities or what, we'll expect you to come back to work, because you would have been given the opportunity to be protected in one way or the other. But what happens, I think it's a matter that we'll have to take on with unions, where you can't come because you have not vaccinated or you don't want to be vaccinated. On the other hand, we have comorbidities. But we're saying we will not give anybody an opportunity, and we'll take it from there. On the closing of schools, if I heard quite well, we've been having engagements because initially our meetings with MECs this morning, it was meant to update them on the work and the progress around vaccination. But because of these high infections that we have observed in the past few days, we couldn't avoid talking about our response as a sector to say, what do we do in the face of these high infections that have been taking place? As I say, we monitor weekly to see what is happening. We get statistics almost every day, which schools were disrupted, which schools, how many learners were affected, for us to take an informed decision. And this morning, when we reflected on that, all provinces, including national, agreed that yes, indeed, any infection is one too many, but the levels of the current situation we find ourselves in does not warrant that we should close schools. I gave an example that this week, in the information that we collected, 100 schools were reported to have been disrupted, with the majority of them being in Gauteng. And we're saying we have 25,517 schools. 100 schools were affected. So 25,400 and something schools were stable. And we just felt, on the basis of facts, there would not be any ground for us to go for a wholesale school closure. That we should continue to have what we are currently using, a differentiated approach. If there's any reports of any difficulties, the principals know what to do, the circuits know what to do, and we'll manage it that way. But we are also not ruling out the fact that if any time during the week, advised by your ministerial advisory committee from health, advised by the National Command Council, advised by cabinet, we will resist closing schools. But we felt that schools are closing in any case quite soon. We're going off quite soon. I think less than 2 weeks. We'll be breaking, and we will want to break orderly now that we have a very disrupted system. So when you go on break, teachers have to prepare work for kids to go home and really make an orderly closure of schools, and we prepare ourselves for the next term. So for now, as I said, the view in the sector, both from the provinces and from all the teacher unions that we met this morning, with the school governing bodies, there was one or two that says we have to close for 3 weeks and other things, and when we come back, COVID will be gone. I don't know. But the majority even of the school governing bodies, they felt that there's no basis for it. We also met the principals' councils, and all principals themselves felt that we should continue with the differentiated approach, and as principals, they'll manage the problems as they arise using the protocols that are there. We also met independent schools this morning. They also were of view to say, as a sector, we don't think we've reached a stage where we should close schools, we should use a differentiated approach. We also met the associations of governing bodies that are responsible for special schools. Themselves also 100% felt there was no need to do that. Let's handle the situation on a differentiated approach and deal with problems school by school, province by province. So if the infections are high in Gauteng, let's work out with Gauteng how we manage Gauteng. But if for some reason there's a province or even a district where there has been no infection, there will be no reason to say they must close if that area itself is not highly affected. Because from our monitoring, the trends match the infection rates in the different areas. Last week, it was Northern Cape, the infection rates were high, a number of schools closed. This week, it was Gauteng, the infection rates are high in Gauteng, most schools were disrupted. So other provinces were not disrupted, so we don't think it will really be a fair decision. Or to be a fair decision. So we can so to happen. Likasizulu. Ongicacise kancane ke mhla khulu indaba yokuvala isikole ngoba ngiyazi abazali abaningi bakhathazekile ukuthi njengoba abantwana igciwane ligcwele kwenzakalana. So sivumelene singama governing body, ama unions, ama province, abazali babantwana aba need uncedo nezikole zizimele. Sivumele ngokuthi yebo isimo sibi, ama infection aphakeme futhi into enzima asayina sebantwaneni. Kodwa into efanele siyenze ukuthi si manage lenkinga school by school. Makhona inkinga esikoleni esithize makubhekwane nakuleso sikole esithize. Makhona inkinga kwi province esithize asibhekane naleyo province. Singavali zonke izikolo. Ake huitswe ka mkhwa dumelani ka teng. Le di province mekhatlo ya matitjhere, mekhatlo ya batswadi, your school governing bodies, mekhatlo ya batswadi ba shebang dikolo tsa bana ba tlhokang thuso, le mekhatlo ya dikolo tse ikemetseng. Re dumelane ka hore tsietsi teng tshwaetso ya kokwanahloko ya COVID-19 e phile matla ka ho tshwantse re be hlwatsi re bule mahlo haholo re tse hore re fanyi ho hang re tshireletsa maphelo a bana ho aparwa di-mask ho hlatsuwa matsoho bana ba emela thoko ka mokgwa ntse re tswela pele jwale empa hona le tsietsi sekolong ho shebuwe tsietsi sekolong seo ho ska shebuwa tsietsi ho sector kaofela ha tsietsi e le hodimo Gauteng ha re shebana le Gauteng re bo re tshwarisana jwang le Gauteng ha tsietsi bekeng e fitleng tsietsi ne le Northern Cape bekeng e ne e sena mathata a maholo so re na re ha re tla matha mohlomong re ya hohle re tla ba le tsietsi so benti ndicacise njalo andazi ke mhlawumbe nabesixhosa abasivile ngosisizulu niyasiva ngusani niyasiqonda ukuthi sivumelene ngokuthi okwangoku masiqhube nje ngokuthi sijonge isikolo ngesikolo singavali zonke izikolo ngengxaki esesikolweni esithize makhona ingxaki esikolweni masivale so sikolo makhona ingxaki eprovincini masijonge lo province kodwa okwangoku asithi ukuthi asizujika okwangoku sizi-province zonke ama-teacher zonke teacher unions abazali bonke sivume ngokuthi masibambisane sijonge nale ngxaki isikolo ngesikolo and into emandi kwiveke ezimbeni izizayo izikolo ziyavalwa so sithemba ukuthi mase sibuya noko izabe seyihlile siphinde sisebenze kahle ndiyabulela.
So just in response to the vaccine hesitancy question, our teacher unions, the 5 biggest teacher unions, did a survey and they've repeated. They started the survey in January, and they followed it up in May of this year. So in January, 52% of all teachers said that they would not take a vaccine when it became available. That percentage has increased quite substantially to 76% in June. So 52% said they wouldn't take it, and we now have 76% of teachers saying that they will take it when the vaccine becomes available. It is still concerning, and that's why we have agreed with the teacher unions on a communication strategy where we can all reach out to teachers to emphasize that vaccines are safe, they're effective, they're probably the game changer in terms of getting us beyond COVID. Thank you, Chair.
Thank you so much, Minister. Thanks, Dr. Whittle. Can we do the second round now? I've just been alerted that there's a hand that I didn't see. There at the back, it's dark. There, colleagues, it's dark. They try to sit here next time. Just try arrive early, ne? Because all the lights are here. Okay, now there are new hands. Okay, let me start with a WhatsApp group so that we come back to the room and focus on what is taking place inside here. Ignatius?
Thank you, Mr. Mhlanga. There's a question from Fred Daniels from UNCA. She asked, is there a particular plan for Gauteng other than vaccinations? The province has already closed some schools, and it seems schools are doing different things in terms of dealing with the pandemic. Are there additional measures being taken in Gauteng to safeguard teachers and people? Another question from UFM. Often political parties use school buildings to hold meetings, and seeing there will now be an election in the pandemic, does the department have a position on whether to allow the use of schools for such purposes?
Question and answer session there going on as Basic Education Minister Angie Motshekga continues to outline ways through which they'll try to stem the tide of COVID-19 infections within that sector. We'll take you right back in just a moment.
From Nasir.
That you sent me.
Thank you, Elijah. My name is Mahlaku Komane from SABC News. I think also, it's probably a bit addressed there, but I also wanted to find out, in terms of, the minister did say you used Gauteng as an example, so we'll stick to the Gauteng example that there's 25,000 schools in the province. What happened last week was less than 10%. Are there any thresholds that the government, as a department, that you have in terms of when do you consider it not safe for schools to continue being operational? Is it half the school? Must it be 50% of the school? Must it be 50% of a district? At which point is it considered unsafe for children and educators to continue going to school as though things were normal? And also, I understand that the guidelines obviously continue changing. In terms of schools needing to be fogged or disinfected, what is the position there currently? Because some schools, they'll just send the child home or the 12, 20 children home, and it will continue to be business as usual. Is it still a thing to disinfect schools, or handy Indian water? Oh, okay. Thank you very much.
Yeah, it's 25,000 schools in the country. Ne? In Gauteng, it's about 2,100, thereabouts. There was another hand. Okay, let me start on my right.
Good afternoon. My name is Tsegoma Agi from DSTV News. I'd like to know the vaccinations that have been secured, will they be sufficient for those in the basic education sector? And is there a stipulated plan as to who will start with the vaccinations? Will it be teachers or principals? Is there a plan set out like that? Thank you.
All right, thanks for that. Slindelo?
Just one more thing, Minister. Last time I spoke to you, which was last year sometime in July, you spoke about a coronavirus, the threat of a coronavirus generation, and the pandemic erasing some of the gains that have been made over the past couple of years in the sector. Where are we in terms of the catch-up program? And have we seen that the 2020 program has had to spill over into 2021? And what is the plan for matriculants as well? Thank you.
All right. Thank you. Any more questions? Follow up.
Sorry, Elijah. Mahlako again. There's one question that I forgot to ask. I just wanted to find out, in terms of the curriculum catch-up, what has happened there? Do you have any idea where that stands? We did see that survey that came out that there were big gaps. Have schools managed to cover this, especially in areas where children are at school once every 2 weeks? Have you gotten an update from provinces as to what is it that's going on in the ground? Because literacy and numeracy were one of the areas that were seen as having issues there, and there were already historically issues there. Do we have an idea of how far schools have managed with the curriculum, including what they were supposed to catch up from last year? Thank you.
All right, thanks for that question. It's almost the same as the one that Lindelo asked, so I think it's going to be dealt with in terms of the curriculum implementation under COVID-19. Any other hands that I can see? All right, there's one that just emerged.
Linda Mnisi from Newzroom Afrika. I don't know if, Minister, you've touched on this, but I'd just like to get some clarity in terms of, some alternative plans. I mean, in various townships we've been seeing the protests. So do you see those as a threat to the vaccine rollout? And do you have any plans if those protests disrupt the vaccine rollout?
All right. Thank you so much for that question. Minister, I'm going to ask you to please come.
On the closing of schools, the protocols give guidance on different approaches because the infections will appear differently. And sometimes because of the anxiety that we have about the virus, there will be different expectations, different from what we would have guided schools to do. For instance, if you have an infection or you pick up, because in the morning, after children have been, the temperature has been assessed, they are isolated. If the temperature is high, they're taken home. So which means the school has not been infected. And that's why we have those private places so that we can protect the center. But sometimes if committees pick up that there's a child who was turned back because the temperature was high, they expect you to shut down the school. There's no need to shut down the school because it would have been contained at the right place. In some instances, you find a person, maybe and that's how health works. You'd find that the person who presented or who has been infected, the support staff from the gate was in the office, never went to any class. So the way you handle that is different. It's not the whole school that has been contaminated. You will deal with that place where there is possibility of contamination. So you have to understand how the contamination would have happened and how it will affect the school. Again, we'll be expected to say the clerk presented has been diagnosed with COVID, and maybe the clerk has not even gotten into contact with anyone. No learner, maybe has not been contacted with teachers, will be expected to close the school. So we're saying there are differentiated ways in which you deal with the virus in terms of how it presented itself in the schools. There's this whole thing that when we pick up that there has been a person with the virus, we close for 10 days, there's understandably a big concern. Health tells us that the virus itself does not live for 10 days. Does not live for 10 days. You don't have to close for 10 days. What you do, you identify the people who have been in contact, and this is what they do, this contact tracing, and get them to go and isolate, not the entire school, those that were in contact with the person who has been infected. So, and people get surprised to say other principals do this way, other principals do this way. It depends on how the school itself, and that's what they have been trained on, identify the source of the infection, how much, what impact it would have had on the school, and therefore what is the appropriate action. In some instances, for instance, my grandchild goes to a school here in Pretoria, Boys. He plays rugby. They had a huge infection at the school. We were told to come and pick them up. The school didn't close itself because the school picked up that the infection came through rugby. So all the rugby players were removed. They say we must take them and keep them home for 10 days because of isolation. But the school continued because the school could, and were assisted by health, determined that it was the rugby team during this intersport that brought the infection, and therefore there was no need to close the whole school. In terms of fumigations, and it's unfortunate again that we expected to fumigate schools, and I think different provinces did it because we all knew very little about the virus when it presented itself. But health came back to say, actually fumigating schools is exposing learners to more problems than we think we are solving. Those chemicals can negatively affect young people. Rather, when there's been an infection, sort of fumigating and do all sorts of big things with chemicals, you leave the space, it gets cleaned, and the virus won't be there. And health even guides us to say on this surface it lasts for so many days. On paper, it lasts for so many days. That's why even how we handle paper, we've been guided that in paper it lasts for 4 hours. After 4 hours, it's dead. On hard surface, it lasts for so many hours. On wood, it lasts for so many hours. So again, you guided by even the materials that are there on how to handle the surface without necessarily fumigating the space. Sticking to Gauteng, and that's why I keep on making example about Gauteng, to say, since last year, we've been confronted with infections rates that present themselves differently from place to place. At some stage, Western Cape had huge infections. And we agreed as a sector to say, let's deal with Western Cape issues as Western Cape. Let's not shut down the sector. It's last year. Let's have a differentiated approach. We're saying now we're seeing different provinces coming in and out of level 3 in different ways. Northern Cape was high last week. We had high infections. They had a differentiated approach. Gauteng is high this week. We're seeing higher infections. We're saying, let's have a differentiated approach. Even then, so that it's not a sector issue, it's a differentiated approach in terms of where infections, where the fires are erupting, and those of the fires rather than those or just water the whole place because there are fires that we have picked up elsewhere. And that's why we're making an example about how to say, let's work with Gauteng to deal with the areas where infection has been. For instance, one of the key drivers, especially in schools that have high spot, which is what would have happened in Gauteng, it was contact sports. And what we did, immediately we said, not all sports, contact sport must stop so that we can see how we manage the issue. But at that time, we're stopping contact sport. Lots of kids have had infections because it was inter-school, it was inter-school and inter-houses, and that's why we said contact sport must stop. We cancelled our music competitions because we thought it will be a super spreader. And so, yeah, the approaches are going to be different, and we shouldn't be surprised. Principals were telling me this morning that I think because of the anxiety and panic, they sometimes get reports of infections in their schools which they're not aware of. The principal says, I don't know where the story comes from. No one in the school knows, but people in the community know. They want you to shut the school. And so it just shows the level of anxiety which can create unnecessary problems if you don't handle the situation properly. We should be sensitive when we get information, but again, information must be properly channeled so that it's credible and can be validated. You can't get a person from the committee to say, yeah, there's been an infection, why are you still open? When the principal doesn't know, none of the teachers know, no learner knows, but the committee knows that there's been an infection. And we're guided, as I say, by the guidelines that were given to us. They've worked for us, and we're saying let's stick to that because they have really helped us. It's not the first time that we have to close, shut, open, close schools. We've had to really do that frequently, and I think we've learned now better how to handle when there are infections in our space. The coronavirus generation, yes, I did say that these disruptions are just not very helpful for the sector in many ways. If you recall, the grade 9s only went back to school after July. So which means they've lost the whole second quarter. And then when they went back to school, we had to get a differentiated timetable. They have to, in some provinces, like in some provinces, you come this week, you don't come next week. So which means it's half even of those quarters that are there, let alone that they're very disrupted. So which means almost half of last year was lost. And this year, we opened late. Maybe grade 11s, grade 12s are protected. They don't have a differentiated timetable. But 12 years is not a thumbsuck in terms of the time frames for your basic education. The 12 years has been arranged according to the curriculum that has to be covered. So if you lose a year, it's not nothing. It's a big thing. And I was saying, if we don't arrest the current instability in the sector, we're going to have young kids. And I was giving an example to say a loss of a month could be just losing like losing your finger. So it means you're going to have a generation that comes with lots of deficits into the future because they've lost lots of time. And scientists are advising us to say, and internationally, that at the rate we're going, the generation, not only this, the generation is going to be affected because we're losing too much time, which is time that is supposed to be taught in curriculum. And not only time, we're getting lots of reverse because teachers say, when kids have not been here today, they come tomorrow. It just is very disorganizing even to the children themselves. There's no sense of continuity. Teachers will tell you, maybe I'm talking about something that have not been asked, but teachers will tell you, even when I was teaching, on Monday, you take time to settle the kids until 10 o'clock. They're still excited over the weekend. Then you have time to really settle down Monday, Tuesday, Wednesday, Friday. Then there's also afternoon, everybody wants to leave. So, but at least we have 4 days solid work. But if you're going to have one day, twice, it's just very disruptive and it's not good for us. And I'm saying that's why we'll have lots of effects. And the question was, what is it that we do with the recovery program? I forgot to mention and really express our gratitude and appreciation as a sector on the presidential job initiative. Last time they gave us almost 300,000 young people to come and assist us as teacher assistants and some of them as janitors. And the reports I've been receiving from schools were really encouraging that in areas where, because it's quite difficult to handle our environment in this current situation, but with these huge cohorts of learners, teachers were able to focus on key activities, like they don't do marking, they don't do supervision. Then these young people will help them to really do the other extra work that teachers find themselves doing so they can focus on teaching and can cover as much work as possible. But some of these education